Yes.
Okay. So I've been talking to you guys in the past about medical cannabis and the all the information and details and a lot of the science behind it, but we're finally starting to get a few colleges and universities that are starting to provide the education that is appropriate and necessary for a lot of these clinicians that are out there that want more information and want to be able to make recommendations properly. And I was actually contacted by John Patrick University, who they're located in South Bend, Indiana. They've been in operation since I believe 2009. They were, but today I just want to give you a little bit of an intro to JPU, the School of Integrated Functional Medicine. Sorry, the Elm Academy of Integrated Health, and the Institute of Cannabinoid Medicine. They're all part of JPU. They're all little spin-offs, but John Patrick University is really the one that has been doing the majority of all the planning and everything for the university. Everything that they have right now is online. They are trying to have some people come back to the classroom like once a quarter or so, if possible, when that is possible. But everything they're doing right now is through online instruction. So a little bit about myself, you guys kind of heard, but I've just been a pharmacist at a major national drug retail chain for about 16 years. I've been in the cannabis industry here in Connecticut for actually almost 7 years now. I've been a pharmacist in the dispensary for about 6 years. 2018, I founded Consult CT just because there's a lot of questions and information that people are looking for that the only real place to get it has been in the dispensary after you get your card and everything. And there's just a lot of hurdles to get that even too. And patients just want a little bit more information about what they're doing. So that's what I've been doing for the past few years. And I'm also currently working as a dispensary pharmacist at Affinity Health and Wellness in New Haven. My email's down here. If anybody has any questions, please let me know. So JPU has been in existence since 2009, located in South Bend, Indiana. They are accredited university. I have about 50 plus faculty, 12 administrative staff, and about 25 plus teaching assistants. A lot of these slides I'm going to go through pretty quickly. It's just some basic information about JPU, but there's some more stuff about the TIOCM, the Institute of Cannabinoid Medicine, and stuff that I want you guys to see. So um, you can see some of the recognitions and approvals that we've gotten. The SARA approved in 49 out of 50 states, licensed in California. We do accept federal aid, do accept the GI Bill and VA loans as well. So full access university. So they have the School of Physics and Radiological Sciences was the first one that they founded. That's really kind of where everything started for them. Our founder is a neurophysicist, and he is a very, very, very smart person with a ton of energy. So you can see all the different master's programs that they have here available and everything too. Medical physics, medical health physics and such. And then also do a lot of certificate programs as well for those who have degrees and aren't looking to go get a full master's or anything as well. That's a little bit faster. And some of the bachelor programs, they're still hoping to get accreditation for them before the fall semester begins. Medical and imaging science. So, they do have a BS in nuclear medicine, ultrasound, CT, MRI, and some certificates you can get as well. School of Business. There's the MS in Healthcare Administration, and you can specify there be with executive oncology, radiology. And one of the big things you guys can see here is the memory care that we're doing. They're really looking to get into Alzheimer's and a lot of the information there and helping with the clinicians to do that too. That's one of our founder Brent, his real passions is getting into memory care and Alzheimer's too. Um, and then the School of Integrative and Functional Medicine. This is kind of really where everything is for us. So as you can see within that, there is a concentration in cannabinoid and medical sciences. We have some of the best cannabinoid science professionals in the industry. We actually just enrolled the Knox family. I don't know if anybody knows who they are, but they're from, I believe, Northern California. It's a mother and her two daughters that have been doing this forever. They are all physicians. And they are super, super smart and have really been integral in making this much more educational and providing that medical education that people need. We do have the lifestyle medicine, the nutrition, and the sports medicine as well. And we have some of the leading professionals at doing the teaching and educating in those areas as well. And they are working on a bachelor's in the integrative health and lifestyle medication and medicine as well. And you can see the different certificate programs that we offer. Just a quick little blip on some of our leaders or directors of our programs here. Chris Moore is the sports medicine guy. He actually was the athletic trainer for the Cincinnati Bengals. He's worked at a few different universities. He's worked with the White House and the CIA. Janice Bissix is out of Massachusetts, actually. She's our cannabinoid and medical sciences director. She is amazing. She is a nurse. She has a program that she runs up in Mass as well, where she sees patients and helps guide them in their very complicated system that they have up there too. But a lot of our program directors and everybody, I'm going to kind of flip through. Some of you might recognize Felicia Stoller. Where is it? She was the host of TLC's Honey, We're Killing the Kids. She's the author of The Living Skinny and Fat Genes and A Healthy Way to Lose Weight and Feel Great. So she's been around. She's really doing a lot on the lifestyle medicine there and everything too. Michael Dubinowitz, he's our dean. He is so passionate. He is accessible to every one of our students at any time, which I find amazing for your dean. You don't normally get that. But really great guy, really cares about the students and is very involved in every student and making sure that their experience is everything that they need it to be. Like I said, the rest of these I'll kind of flip through pretty quick so we can get to the important stuff. We do have quite a few clinical sites. We have over 194 currently in the US, and there's quite a few internationally as well. And you can see here too, I mean, they have sites in Tokyo, Beijing, Paris, Mumbai, Brazil, Switzerland. So, I mean, they're really spreading out all over, and that's just going to help our cannabis medicine instruction as well. Elam is another one of the sort of spin-offs or underlings for the JPU. It's just our integrative health college. They do have the diplomate courses. We are also creating CE and CME courses through there as well. So if you're affiliated with the Academy of integrative health here, then you also will have access to the CME CE courses. But they do also have other Alzheimer's, food and psychology, integrative oncology, sports medicine, culinary medicine. They really are trying to do all of your holistic health topics that they're looking to help patients with and help our clinicians with too. And then we have the Institute of Cannabinoid Medicine, TIOCM. So this is really where we have all of the cannabis diplomate course. That's going to be about 100 hours and everything with that. It's a little bit easier than having to go through the entire master's program, which is a full 2-year program that you go through with that. This is only about 100 hours, so you can really get through it as quickly or as slowly as you would like to. I do have a quick video here to show everybody, if you don't mind. Hopefully this is going to work properly. It's only about 30 seconds, but just gives a quick overview. So I'll just play that for you real quick.
The Institute of Cannabinoid Medicine aspires to be at the forefront of the cannabis wellness community, to bring clinical insight into research and development, product and labeling laws, science-based education, and corporate health services, navigated by our passion to provide a leading advocacy, clinical education, and science research to support the field of cannabinoid medical sciences.
So just a quick little blip, but kind of what I've been saying. That was Brad. He's our marketing director. I love these guys because they are just so passionate. Brad's another one of these gentlemen who, never thought in a million years he'd be working in the cannabis industry, and it has just absolutely, fallen in love with what he's doing. He's been able to help a couple of his relatives with some of their ailments and everything as well. And has really started to believe the medical properties and benefits of cannabis, and to watch these guys and their passion and everything, it's so awesome to see how much energy they have and how much they just want to share the information and get it out there to everybody. Um, and then this here just kind of gives you an overview of what the diplomate course would look like and whatnot. So, I mean, you can go ahead and read through all these. I won't go through them all for you, but, you know, applying the therapeutic and pharmacological procedures, utilizing the herbal pharmacology and treatments. You know, it's everything that you want to know about cannabis, plus about 100 times more than that, and ways that it can be applied that you didn't even really think of. You know, possible effects on other medications, other conditions, other outcomes as well, that could really be very beneficial for your patients, and something you might even want to make sure you can caution them about if there's potential interactions or possible side effects that could be negative as well. But just help make your decisions and discussions much more educated and confident as well. TIOCM was just founded in July of last year. This was kind of a pandemic thing that they started. They were very much interested in doing the cannabinoid medicine master's course, but they really wanted something for clinicians that didn't want to go through a full master's and still wanted a certificate program and everything too. And they will be starting with in this fall, actually, with our first class. So if anybody has any interest or anything, please let me know. Be happy to help guide you guys with anything there. And then just some of our partners that we use. Cannakeys is a great resource for clinicians. It actually goes through and breaks down every single one of it, like every condition. It can give you an idea if there's cannabinoids that will help, whether it's you know, just THC, THC and CBD combinations, CBD alone. It actually refers to them as chemovars. It can break down different terpenes and other cannabinoids and how they might be appropriate for each condition. And there are hundreds and hundreds of conditions that are listed on there. But what it does is it actually gives you all of the studies linking you to where, you know, what the research is regarding this particular condition and cannabinoids, and whether or not it's appropriate, if there's enough information or anything as well. And United Patients Group is one that I've always loved and am very proud to be a part of as well. Really just a patient support group. They're based out of Northern California. John Malanka's who's in charge of that, and he is one of the nicest human beings I've ever met, and is constantly bringing some of the best professionals on his podcast, and really just sharing as much information as he possibly can. So a lot of great resources there. And then some of our other resources that we have as well from some different, you know, cannabinoid nurses, and, you know, some lifestyle education and stuff as well too. So anybody has any questions on any of those, again, please reach out. I'm happy to share any links or share the whole presentation or anything too, if you like. You remember this, guys, when we actually used to be out in public and get to hang out with people and visit people and be close and not wear masks. So as you can see, we've been out and about, you know, trying to get to know everybody and spread the word as well. So thank you for the opportunity today. I appreciate it, and happy to take any questions from anybody.